For those who have been diagnosed with a condition called atrial fibrillation, there is a concern of an increased risk of stroke. But for some, a minimally invasive procedure could reduce the risk of a stroke. This morning on Ask a Specialist, we'll talk about what you need to know with Dr. Benjamin Plank, interventional and structural cardiologist at the Queens Medical Center. Good morning, Dr. Plank. How are you doing this morning?
Good morning, Ross. Good. How are you?
I'm doing excellent. Now, first off, what is atrial fibrillation and how does it increase the risk for a stroke?
Yeah, thanks. So atrial fibrillation is a very common type of heart arrhythmia, and that can cause several things. It can make the heart beat irregularly. It can make the heart go fast, but it can also increase the risk of blood clots forming in the heart, which can lead to stroke.
Now, Doc, what is a stroke and how can it be prevented?
Yeah, so a stroke is an injury to the brain, and it typically happens when there's a cutoff of blood flow to a part of the brain. And this can occur when a blood clot travels through the bloodstream and lands in a blood vessel in the brain. So a blood clot that can form in the heart in somebody that has atrial fibrillation can potentially travel through the bloodstream from the heart and land in the brain and cause a stroke.
We're also hearing about something called a Watchman implant. What can you tell us about that?
Yeah, so to help prevent stroke in people that have atrial fibrillation, typically they're placed on a blood thinner. So there's lots of patients out there in this state that are on blood thinners to help reduce the risk of a stroke by preventing blood clots from forming in the heart. But now we have a device that's designed for people that may not be able to take these blood thinners because of increased risk of bleeding while on blood thinners. The Watchman device is a small flexible implant that's placed in the heart using a minimally invasive procedure. The implant is permanent and it will permanently reduce the risk of stroke without the need for blood thinners for a lifetime.
So who should be considered for Watchman?
So there are lots of people that would be candidates for the Watchman device. People that have atrial fibrillation that are considered to be higher risk for stroke and that would otherwise be prescribed blood thinners, but that may not be good candidates to stay on blood thinners would be the good candidates for Watchman implantation. This includes people that have a high risk for bleeding for other problems or other medical conditions, or people that may have difficulty adhering to a blood thinner medical regimen. This also includes people that have professions or interests or hobbies that put them at high risk for bleeding, such as just some examples, firefighters, professional scuba divers, surfers. So there are a lot of people out there that may be at high risk for bleeding based on their profession or their lifestyles that can now be candidates for Watchman implantation.
Now, to learn more about the Watchman implant, you can call the Queens Medical Center Watchman Team Referral Line at 808-691-8836. Thank you very much, Dr. Plank, and have a great morning.
Thanks, Ross, and I appreciate you giving me the opportunity to talk about this, especially as this is February, the beginning of Heart Month. So it's a great time for everybody to start thinking about heart issues, including atrial fibrillation and stroke risk. Thanks, Ross.
There you have it. Thank you very much, Dr. Plank.